Hello everyone and welcome to our webinar for today. So this is the next in our series of webinars for Ealthy. We're delighted to see you today. My name is Bethan Edwards and I am the Academic Director at SLC and also a keen Ealthy member. Today we're delighted to be welcoming Virginia Allum, who is going to talk to us today about writing materials based on the workplace. So I'm going to hand over to Virginia. So any question, just a little bit of housekeeping, any questions that you have, you can pop them into the Q&A button on Zoom, and we'll pass them over to Virginia towards the end of the session. And any other technical questions you have during the session, just pop them in the chat box and we'll do our best to help with those. All right, so I'm going to hand over to Virginia.
Right, hello everyone, and lovely to see you. Just a quick about me. I'll just minimize that. Right. I am the head of medical English for specialist language courses. I'm also the clinical nursing advisor for Ealthy, and I am an item writer for various organisations, including Infirmier, French Nursing Magazine, and Occupational English Test. So a little bit of a range there. So I will get onto the onto the topic now, which is about writing workplace materials. Oh, wait a minute. Why am I not? Here we go. Right, so a little bit of a background about workplace medical English materials. My first experience was writing or co-writing the Cambridge English for Nursing books in 2008 and 2010, co-writing with Patricia McGarr. And that was basically to fill a hole in the ESP market. There wasn't much available, and the books were part of a series, an English 4 series. They were workplace based, but really general nursing, English for nursing books. And then moving along, after 2014, I became more interested in preparing candidates for OET, for the Occupational English Test. And also with developing materials for workplace readiness and integration into a new workplace. And then more recently, helping to shape updated English for nursing courses that are within a diploma or a degree, nursing degree course. So quite, I think writing workplace-based medical English courses has changed quite a lot over the years. And just and excuse me if this is well known, but I think it's worth having a look at what exactly workplace-based course materials are, and there is such a range for writers, starting with speaking. So, you know, the obvious interactions between a patient and a healthcare worker, and that could be a range of communication skills, concerns about pre-op care, post-op care, concerns about continuing care, healthcare workers explaining a procedure, explaining equipment, and then the healthcare worker to healthcare worker, and that's your handovers. It could be discussing a patient, talking about ongoing care, and then the healthcare stakeholder to healthcare worker, and these are featured in Occupational English Test, and that could be a hospital manager, sorry, or a care home manager, talking to healthcare professionals about perhaps a change in guidance, new equipment coming in. It could also be discussing an adverse event, a recent adverse event, and how it could be prevented. Then going on to reading, and this is an area where a lot of, we found a lot of our OET candidates struggle. There's a lot of reading to be done for healthcare workers. The first one I've got there is hospital documentation, and I mean the range of hospital documentation is huge. Policies, procedures, guidelines, guidance, writing case notes. It could be authentic case notes for someone about to go and work into the workplace, or it could be the sort of case notes that modified case notes used in occupational English test. Could be writing a patient file entry, reading a patient file entry. It could be reading health-related information. And by that, I mean the sort of information that healthcare professionals need to perform their day-to-day work. It could be looking up a medication. It could be refreshing your information or learning about a health condition. It could be going back to hospital documentation, checking that you've got that you have an understanding in what's needed for a particular patient's care. And that that health-related information can be in the form of a text. It can be or a reading text. It can be in the form of a table, statistics. It can be a flow chart, as in, does the patient have these symptoms? Yes, well, do this, that, and the other. Does the patient have these symptoms? No, well, follow this route. Other reading is journals, and this could be for your own development as a healthcare professional. It could be to update your knowledge about a specific condition. Emails, this is a new one for both reading and writing. Emails are, as we know, are different from a letter in their format, and so understanding how to read a condensed version is important. And memos, and they are typically hospital or workplace-based notes to employees about something that's changed or something that they have to look out for. And then listening, and again, listening, a huge range of opportunities for listening in the workplace, not just the interactions that you have with colleagues, and that could be as a handover, or it could be discussing a case. It could be talking to patients. It could be talking to patients' carers. Health podcasts, they're quite interesting ones to write. They typically are produced for the general public to be able to absorb easily. So that's quite a different listening style, in that you might not hear a lot of medical terminology. It may be more everyday health language. Staff briefings, talking to staff before a shift about what they need to look out for. Patients with the same name, patients with taking a medication that has particular precautions, perhaps discussing recent adverse incidents, asking staff to pay particular attention to patients who might be at a higher risk. Handovers, we've discussed that before, but they can be quite a range of an end of shift handover. It could be an impromptu handover before a break. It could be handing over important information to a colleague that you want followed up about. So again, they're almost a topic in themselves. It could be listening to informational sessions, and this is an example of that would be perhaps a pharmaceutical representative coming to talk to staff about a new type of dressing, a new piece of equipment that's being brought in. And again, that could be quite technical, understanding how it works, what they have to be careful with. It could be a drug update, and there's a wealth of listening experiences about drug updates, because they seem to happen very frequently and are obviously necessary for to be able to work safely in the workplace. Last one is writing. So writing to colleagues about a patient's care, about follow-up care, maybe a referral to a specialist for further advice about care. It could be writing to patients about a discharge plan, or patients' carers, again, about a discharge plan. Writing notes in patients' files. This is more workplace oriented than OET preparation, but it's the sort of thing that they're going to have to be able to do, and that includes using abbreviations and acronyms, and that has changed over the years to become a lot more standardized. There are abbreviations and acronyms that are not allowed anymore. And the reason for this is for patient safety, but also to make healthcare documentation much more standardized. And I'll talk about that a little bit later. And finally, writing emails. So as you can see, a lot of these materials can easily be integrated, and I'll talk about that later as well. So what are the materials, or what do I write the materials for? The first area is writing for a language test, the occupational English test, and you've got two examples of some SLC courses there. The Reach OETB nursing. It's called Reach OETB because OETB level is the basically the pass mark to enable a healthcare professional to work or register in their professional register so that they can work overseas. And then you've got the example of a practice test. So one style of writing is for test preparation, and it's quite specific in what's required. Another group of courses for preparation for the workplace. And if you look at a timeline, you've got the test preparation to be able to work overseas. And then once you've got that job, you've got to understand how the workplace operates and what the hospital culture is, how you communicate in that workplace, which could be quite different from your experience in another country. So it's very much communication skills, and you can see that in the title of the doctors one, English for Doctors, Advanced Communication Skills. So these courses are specific support for healthcare professionals as they go into the workplace. And then this is a more recent area of writing, which is really quite exciting, and it's for the international market. There's an example of a course there for Vietnam, for VinMec. And these are modular in that the stakeholders will take the modules from the courses that are written, and they're customized for their own needs, which might be slightly different from courses that aim to prepare people to work in the UK, for example. So it's quite interesting to see what their needs are and what materials that they need for their own particular environment. So that's another area of writing. So when I look at writing materials, what are the sort of things that I look at, or what do I want to achieve with my materials? And in most cases, apart from writing materials for beginner or pre-intermediate level, the idea is to improve the language level to B2, C1, and that the reason for that is to get learners to a level where they can either successfully pass a test like the OET, or operate or communicate safely in the environment. And B2 C1 is the level where you would feel confident that that learners would be able to communicate safely. They'd be able to listen and understand and write entries into a patient file, for example, and write letters of referral. And so as I said, the aim is to help them pass the test, but also to help them integrate into the workplace. And from an altruistic point of view, I hope that my materials will enable learners to be able to make use of their qualifications, which are often hard-earned, and improve their circumstances. And if that means moving overseas to work, or if it means staying in their own country but having the opportunity of a better job, a better position, then that's a really good feeling to think that I've been able to help them achieve that. But what do the learners want to achieve? And if you look at the three bullet points I've put there, you might notice that it's not in the same order as what I've said. For probably most of the learners that we have at SLC, they just want to pass the test the first time, if possible. Looking at OET, it's a very expensive test. It's quite a burden for many people to pay the money to pass the test. And if they're not at that level, that B2 level, when they start to prepare for the test, they are at a disadvantage, and unfortunately the likelihood is that they won't pass. And this is a real burden, but from their point of view, the reason they want materials is so that they can pass that test. They might need to complete a compulsory unit of the English for nursing, for example, for a diploma or degree. So without passing that, their whole degree, they won't pass their whole degree. So that's quite motivating. And finally, I think they do want to improve their language level, but it comes as at the bottom of the list. So when I sit down and before I start writing, there are some considerations that I have to look at. And obviously the first one is the writing brief. I've just talked about the different areas that I work in. And each of those areas has a particular brief. It could be they've got a template that they want followed. It could be a certain style that they want. OET, for example, has a very definite style, has very definite things to follow that you can and can't do. The second thing is to look at the known knowledge gap of learners, if we know if that is known, and one thing that we do know about our OET candidates is that there seems to be quite a knowledge gap in reading skills. A lot of the candidates will admit that they don't read very much at all, and so that's quite difficult when you think about preparing materials, because it's if you come from a position of people not having that habit of reading, or even that desire to read, it's a little bit of added pressure on a writer to produce materials that learners will want to read or want to use. The second thing is to think of the appropriateness of the materials, and by that I mean we say that the materials have to travel, and I think, looking at the movement from my early days of writing a book or writing books for Cambridge, to writing online materials, it opens up, whilst books are obviously sold all over the world, but online opens up a much bigger market, and materials have to be neutral enough, I guess, so that everybody has access to them. I have to be very careful that I don't localize, that I don't use expressions that may not be understood from one area to another, and that can be quite difficult sometimes, because as a writer from a particular background, you may not be aware until it's pointed out that, well, actually people here don't understand that, or that they would expect you to say such and such. So when you write materials, you're never alone. You've always got either an editor or someone looking over it and saying, oh, well, hang on a minute, that expression wouldn't be understood, or that is known by something else here. Materials have to be appropriate. They have to be able to travel. Obviously, writing engaging activities. The idea behind all the activities that I write is that they have to encourage the learner to participate in some form, so that they're actually doing. And that's probably part of perhaps my own experience, that I have to do. If I'm learning something new, I have to do or be involved in it for it to stick in my head. So it's probably taking my own experience into what I think is a good way of learning, and that is by doing. And that could be constantly recycling, having activities that start off perhaps with a vocabulary matching or vocabulary activity, and then putting that vocabulary in context. Then maybe that vocabulary is seen in the reading text, so that it all flows together, and it's that constant reinforcement, constant seeing that vocabulary, seeing it again and again in context, in another context, and then answering questions about it. What does it mean? Why did they say that? Keeping them on their toes is the idea behind the activities. But also scaffolding activities, so that learners are supported, so that they're not expected to go straight into an activity and do it. They are given that support, and I like to get learners to think about why they might be doing something, why they might be reading something, so that they get into the habit of not just looking at a text and starting from the beginning and starting to read, getting them to think about why they might be reading that, why that text might be important, why it might be useful for them. And I think that helps with that helps to engage and to make things a little bit more interesting. because some, you know, what we also find is that some learners have come from an experience of being given a text and just told to start, and they tend to start at the beginning and carry on without really thinking about why they're reading it. And finally, teachers. I like to consider teachers when I write materials, so that it's not simply a set of activities for students, but there's also support for teachers and in the teachers' notes, so that they have a better idea of how to teach the materials. And this has become more. We've become more aware of the importance of this in certain countries where teachers may not have any background in teaching medical English courses. They may not even be teachers. They may be healthcare professionals who have been co-opted to teach a medical English course. So whilst they understand the clinical background to a lesson perhaps, they may not fully understand what the importance of teaching a clinical skill, or what goes behind teaching a communication skill, not clinical skill, sorry, teaching a communication skill. They may not understand the mechanics of giving a patient an explanation, for example. We've been made aware of the importance of teachers' notes and how welcome they are. And so I like to think of, when I'm writing, I'm not only writing for the student, I'm also writing for the teacher. How can I help both to reach their goal? I like to write value-added materials because I think that it's good to integrate skills, because that's what you do in the workplace. You might listen to a patient telling you about what's been happening with their health, and then you'll write notes in the patient file. You might write an email to a colleague to ask for advice. You might go and read up about something that the patient's told you about that you're not quite clear about. Maybe it might be a medication that they're on, you're not quite sure about it. So in the workplace, all the skills are integrated, and I think it's quite good to do when you do an activity that or write activities that there's the potential to integrate all the skills, so that it's not just this is you're going to learn how to explain things to patients. No, it's going to be integrated as it would be in the workplace. And that also gives the opportunity for extension. Now that could be in the teacher's notes, for example, giving them some ideas about how it could be extended, you know, what else you could get students to do if they're a little bit more able or more interested, perhaps. Again, the materials have to be interesting and they have to be up to date. And, you know, as I've said before, with writing online materials is great because they can be updated. And that's quite difficult for a writer, in the sense that you have to be aware of what needs to be updated. So I do an awful lot of reading and keeping an eye on new health information, and thinking about how that needs to be, how I might need to change and update materials that I've already written. Or again, if there is some updated health information, that's quite an interesting new activity or new piece of materials writing. It enables you to recycle language that they might know, but also you're going forward and saying, well, now here's the change. The other source of up-to-date information is the World Health Organization has the World Health Day of, and a recent one that I wrote for Infirmière was the World Blood Donor Day. So that's a good source of material or for me to write information for me to write materials on. The material has to be future-proofed, and one of the big things is looking at mobile learning. It has to be able to work on a small screen, and you have to be able to update it. But more importantly, I think it has to be bite-sized. And this is, in a sense, has always been an issue with writing medical English materials, especially for healthcare professionals who are already working and who are needing to improve their skills. As we know, they have very little time. They may have worked a 12-hour shift. The last thing they want to do is sit down and do an hour's activity. That might be very good for them, but they just can't do it. Having something that's bite-sized has two advantages. One is that, and especially if it's on a mobile, you can do it when you're on the bus on the way to work. You can do it in your break, your lunch break, if you get one. You can do it in a short amount of time, and it's just enough. It's that Duolingo thing, do 15 minutes a day and you start learning a language. But it's the same thing, having those activities, writing activities that are bite-sized, that someone could access if they just have a little bit of time. Again, it's getting the information in the brain. It's recycling it. It's maybe reminding them that they already know it, but refreshing their memory. So that's another thing to think about when writing activities. Could they be made into that style of activity? And of course, I already spoke to you about the differing wants of learners. So striking that balance between what they think they need and what you think they need, and really what they want and sometimes insist on, which can be difficult in sort of encouraging them to think about improving their language skills, which will have the flow-on effect of helping them pass a test. So trying to strike that balance is sometimes quite difficult. Right. So I think I've covered everything about my reasoning when I write materials, and the sort of things that I keep in my mind when I'm writing materials, but I'm ready for questions. Right, let me see. Questions and answers. Okay. Question from Basim Faraj. Wondering about the needs analysis in the part of learners themselves. Yes, and what tools you've used to collect such information before you start designing the course materials. Yeah, thank you. Interesting question. I mean, there are several ways. The questionnaires, obviously, asking them about what they want the course for, what they need the course for, where they see themselves, what level that they see themselves at, and that's quite interesting when if that needs analysis is paired with an assessment test. Sometimes the way that the level a learner sees themselves is not the way they test out. The other interesting way was having focus groups, and this was done recently for a project, talking again to focus groups about what they saw their needs were in their particular area, in their environment, what they use medical English for, what's important for them, what isn't important for them. And there were some interesting outcomes of that focus group, especially from teachers, what they need, what difficulties they have, how they manage, and for us to ask them, what do you do about that? How do you manage? What would you like? How could we help you? So that those two, I think, the questionnaire with a focus group, if it's at all possible, is a really good way. It's a really good way of doing it. And interesting, again, getting back to the focus group, there were focus groups with groups, sometimes large groups, and then there were the individual chat, particularly with anyone in the focus group who perhaps had a lot to contribute, or had actually spoken quite a lot. So it was interesting to pull out individuals, and sometimes they were prepared to maybe say be a bit more honest than they might have been in a group. So that was interesting as well. Anonymous attendee, thank you for attending. Does writing materials for pre-service differ a lot from in-service healthcare professionals? Yes, it does. It does, because the outcome is so different. I think the pre-service, if you're looking at pre-service in the sense of passing it, preparing for a test, and in service, having passed the test and started work, looking at the occupational English test, for example, it is extremely specific about how the activities, what the activities are, what the type of texts are, how you write those texts, how you produce the activities. It's extremely controlled, and very difficult to write, in the sense that it doesn't necessarily, although it's designed to be workplace, if in a workplace environment, it's not always, it doesn't always end up as looking like an authentic workplace environment. So that can be quite challenging. Writing in-service healthcare professional material is a lot more oriented towards what the particular healthcare area needs, what's going to be relevant, and that can leave you, or that can give you a lot more freedom as a writer, I think. It also means that you have to be careful that you are going to use, if you're going to use policies and guidance and anything that's specific to that particular area, you've got to make sure that's going to be useful. And I think in that sense, you may be writing material that is adapted and might not travel for other areas. For example, if you were asked to write some in-service healthcare professional materials for Canada, for the Canadian environment, for example, certain things are going to stay the same, like communication skills, reading skills, but some of your vocabulary, some of your listening examples are going to be tweaked, or are going to be very specifically for that environment. Otherwise, they wouldn't bother having it. I mean, if it was going to be a generic set of materials, then then it would be off the shelf. But when it's very specific, when it's for a very specific area, you do the opposite of what you do when you're producing generic materials. Okay, Carolyn Primrose, hello. You mentioned the public, do you still write many books? Oh, okay. Yeah, Carolyn was asking about digital materials and books. The OET nurse, I'm wondering about the when you talk about the OET nursing book, are you talking about the recent OET preparation nursing that I co-wrote with some other people, or the Cambridge English for Nursing books? I know exactly where you're coming from, and I'll use the Cambridge English for Nursing books as an example. The teaching materials and the extra technology and there was something else I think were digital, but the books. Okay. You're mentioning Cambridge Guide to OET Nursing. It's the same difference, I think. It's really it's the publishers. It goes back to the publisher and whether they see the value of having it made digital. Patricia McGarr and I over the years have suggested that Cambridge English for Nursing be produced as a digital version, because it means that, as you say, for teachers, it's a lot more accessible. But there was no desire to do that. The Cambridge Guide to OET Nursing, again, it's the it comes back to whether Cambridge is interested in producing a digital version. I think there's two sides to it. There's sometimes in some seminars that I've been to where we've had a whole range of people from different countries coming to the seminars, and from some countries where we can make the assumption that everybody's online, but not everybody's online, and sometimes the book version is the only version that's available. But I think there's certainly a lot of value in having both options. But again, as writers, we write what we're told to write. So if you're commissioned to write a book, you write a book. I wrote a book again for Cengage English for Doctors. For whatever reason, the publishers decide that they want a book, and as writers, we don't really have much say. But I as a former teacher, I see, I hear you, and I think the last thing we want is to either be handing out masses of photocopies, or maybe getting students to purchase a book that they may not be able to afford at the time or want to buy.
Hi, Virginia. There's a question in the chat for you
as
well.
In the chat. Oh, hang on. Right. Okay. Okay, Lorna. What is your suggestion when it comes to mixed ability classes? I'm teaching medical English. Oh, Lorna, yes. That's such a difficult question, and this was something, or this is something that continues to come up. It's extremely difficult, and the obvious answer is to I guess look at your whole class and work out where the middle ground is, and that may mean that you've got I mean, hopefully you have the bulk of people at a certain level with a few outliers. The people who are more able, extension work, and obviously as a teacher that gives you more work to do. And this is where I when I produce teachers' notes, I like to add some extension possibilities for those students. With the students who are not up to what you consider to be the minimum requirement for your class, you know, it's again, it's the need to offer or to source materials that will support them up to that level. And again, that gives you a lot more work as a teacher. I guess if a teacher is going to, if it's going to be an ongoing class that you're going to teach, you'll collect materials for lower levels. The other suggestion I would say is that quite often materials, for example, that I've written for carers, are good to use for nurses, nursing courses, but they are generally at a lower level. So those materials can be quite useful, and the language is a lot less complex. But really, you know, some teachers in the past have had sort of not only do they have mixed ability, but it's vastly mixed. You know, like one or two from this level, one or two from that level, one or two from that, and it can be very challenging, because especially if you do group work, if you pair someone who's more able with someone who's not very able, it becomes very frustrating, because the person who is more able just doesn't feel like they're progressing, and the one who's struggling feels like they're struggling even more. So I think it's a matter of, as I said, the more able, that's an easy fix. It's a matter of giving them extension work. The ones who are struggling is a lot more challenging, and I would recommend looking at lower level English for health. You'll often see it under, or English for carers. That might help you. Okay, another question from Anonymous. Do you think it is better to teach pre-service nurses in multi-level groups or leveled groups? Thanks. Oh, okay. Again, that's really a flow on from the last question. I think it gets back to the dilemma that writers and teachers often have with teaching pre-service classes, and I think I assume you mean like exam preparation classes, in that we know that they need to be at B2 level, really, to start proper preparation. So ideally, if you have exam prep nurses who are not at B2 level, the ideal situation would be to have those nurses being taught in a different group to get them up to that B2 level, and then the ones who are at that B2 level could start the preparation in earnest. However, it comes down to teacher availability. It comes down to cost. That's 2 classes rather than 1. It comes down to cost to the learner as well. In that, unfortunately, often they don't have the time, they don't have the money to spend getting themselves up to the level that they need to be. And these are all dilemmas for on both sides, for teachers and candidates. But the reality is that it's very difficult to get or to convince candidates that they're wasting their money by continuing to with an exam preparation course if they're not up to the level. So again, I ideally, yes, in different level groups, yes. But if you can't, I think you would have to suggest to the ones who are not up to that B2 level, okay, this is where, these are the skills that we need for this activity. When they can't do it, okay, you need to go and practice, do more practice in those skills. Here's where you can go for that. It's going to be up to them to do that, and that's, there are numerous difficulties with that. But as a teacher, it's very difficult to teach people who are not ready to tackle the sort of the level of and the types of activities that they need to be good at to pass that test. Okay, Petra, what are the latest trends in materials writings? Which types of text, podcasts, emails, guidelines are in demand by healthcare professionals in the workplace? Oh, interesting question. I mean, in the workplace, it's all about making getting a healthcare professional workplace ready as quickly as possible. So making sure that they can access the sort of reading authentic reading they're going to do in the workplace. Making sure they can listen to the sort of things that they're going to listen to in the workplace. Things like podcasts and journals and those sort of things are really good to improve their skills. But in the actual workplace, they need to be up to speed with the sort of reading and writing that they're going to be doing. And sometimes that doesn't match with test preparation, for example. So I think it's interesting. I was doing a review of materials recently, and there were things like listening to patients who phone in, do a phone or video call for a consultation. And this is obviously, I mean, you can hear COVID that's driven this, that patients are, and also shortage of GPs, for example, or clinic pressures, that that more and more of these video calls are going to be made, or phone calls. So that's a new trend to get to help people cope with those sort of listening texts, which are very different. And as we know, it's much more difficult to listen to a phone conversation, for example, about a patient's conditions or concerns. You've got nothing to work with. You've got no non-verbal cues to pick up on. So that's quite difficult. And also, as we know, listening on the phone is extremely challenging in another language. It's almost one of the last things that you become competent in. Video calls a little bit better. You can at least see the person and pick up whether they're understanding what you're saying by the expression on their face. And I think there'll be a need for a lot more of those sort of activities to help learners become competent and become confident with those sort of communication texts. The other thing, emails, we know that in the workplace, it's going to be much more common for a healthcare professional to send a colleague an email rather than write them a letter. Even things like writing a discharge plan, which used to be a discharge letter, but now there's a template that we follow. The template's there, you just fill in the information, and it's often emailed. So I think there's going to be a lot more of those sort of activities to practice those skills. I'm just thinking of anything else that would be guidelines. Again, are pretty. They tend to be. They tend to have a timing of when they change. When you look them up, you'll see this guideline is due to be reviewed on such and such a date. So there's quite a lead-in time for that. There's not going to be an instant change in guidelines unless something specific has happened. And I know when I was doing the vaccinating, we had there were very frequent updates about information we had to give to patients as things change. So I think things like well, obviously the pandemic has shown us that the sort of information that you're providing could change quite rapidly, and that's something that we haven't had for a while, and so I think helping learners to deal with the fact that things might be updated, and so how can they compare? That was what it was. This is what it is now. What's the difference? What do I have to be aware of? Those are going to be the new sort of text, in my opinion. And also, I think something that in my own field, in nursing, the role of nurses is there are changes there. You've got new roles, like in England, you've got the nursing associate. You've got nurses becoming practitioners and moving into clinics, having their own clinics. You've got quite changing roles, and with that comes new types of communication, new types of texts to look at. So I think there'll be changes there, and part of that reason is because of the changing workforce. Nurses particularly, but also doctors. Globally, there's a huge shortage of nurses because of the pandemic, because of burnout, but also because of the baby boomers retiring. So I think you're going to have big change in what nurses do, what roles are, and the sort of texts that they're going to be reading. Yeah, so interesting question, Petra. Oh,
Thank you, Virginia. I think those are all of our questions for today.
right.
That's great. Thank you. That was a really interesting talk, and it's really nice. It's good to hear about what goes on behind the scenes, as it were, for all of the teachers who are using your materials or perhaps creating their own materials. So thank you very much to everyone for coming. The recording will be available on the Ealthy website for Ealthy members. So if you'd like to have a look at it, then come. Either if you're not an Ealthy member, then feel free to join Ealthy, or for those Ealthy members, come and have a look on the members site. And then there'll be another webinar next month, so towards the end of July. So watch out on the Ealthy website for confirmation of the date, registration information, and the speaker for next time. So thank you so much, Virginia. And
thank you for having me. It was lovely. It was lovely interacting with you.
Thanks very much. All right. Bye-bye, everyone.
Bye. Thank you.